Welcome everyone, Dylan Gemelli here today with a brand new video for you. Today we're going to talk about clenbuterol side effects that you have got to know about. But first, remember, I am not a doctor. I am simply giving you information that I've learned over the years for your entertainment purposes only. What you do with this information is completely up to you. I am simply just providing you a little bit of entertainment and information that I have gathered. So, that being said, let's get into this video because many of you that follow me for a long time know my feelings on Clen. So I really want to get all this information out to you. Know, clenbuterol is an extremely powerful stimulant, and what it can do is raise your metabolic rate and help your body to burn fat a lot faster. Athletes and bodybuilders are going to use Clen because they think it's a miraculous weight loss drug and they're going to use it to lose fat while still preserving some of their muscle or to enhance their performance levels as well. Now, I want to talk to you about the side effects of Clen. All right, I hate to be the guy that brings everybody the bad news, but Clen has a ton of side effects and they can be extremely serious. They can be life-threatening. They're short and long-term. So let's just get right into it. Number one, high blood pressure. All right, now because it's a stimulant that we all know, it's going to obviously increase your heartbeat, which can cause severe headaches and it can lead to some serious health issues. Now, during a cycle of clenbuterol, you might want to consult your GP regularly for blood pressure checks, or at least go to the grocery store and stick your arm into one of those blood pressure machines, because if it remains high for too long, you could cause some irreparable damage to your heart and your kidneys. And trust me when I tell you, one of the number one complaints that I have with Clen is about an increase, or Clen, is an increase in blood pressure. Insomnia is also going to be on that list. Now, the stimulant effect of Clen can last for 30 to 40 hours. So you're going to likely struggle to get some sleep, or at least good quality sleep. Now, your body is going to adapt to it over time, but a lack of sleep is going to deprive you of growth hormone essential for muscle building. All right? It's also going to leave you feeling quite lethargic and pretty weak, not to mention dramatically impairing your concentration and your focus. Muscle cramps are another well-known side effect that go along with Clen, and that's why a lot of people talk about taurine and taking taurine and supplementing it to help. Now, taurine is a vital amino acid, and it contributes to overall muscle size, strength, and, regrettably here, what happens is Clen is going to actually draw that out of your muscle tissue. And that's what really hurts and causes these cramps. It can cause a lot of discomfort, which can impair your recovery as well as your performance levels. Next is nausea. Now, again, because Clen is predominantly a stimulant, you could experience nausea as a result of using it, particularly if you're prone to similar effects from other stimulants like caffeine. Now, you may also suffer from a loss of appetite, which in turn can affect your recovery and can actually decrease your intensity in the gym. Then, tremors. This one is scary, okay? A common side effect of many effective stimulants is tremors, and that can occur because of elevated heart rates. The thought. Dosing correctly is really critical here, because the only way to limit the tremors is to allow your body time to adapt to clenbuterol. High doses when you start a cycle will leave you shaking and feeling jittery all day long. And just think about that. Just sitting there and all of a sudden just shaking and, it's just the thought of that. And not to mention, you start doing those things, and especially if you're prone to anxiety or something, throw you right into a panic attack. And if you don't have it, it could still start you into having it. And I don't wish that upon anybody. No one whatsoever. Then we've got dehydration. All right, probably the most common side effect of Clen is dehydration, and it happens because of you increasing your heart rate, which causes you to sweat, and then you lose significant amounts of water. Now, not only can the sweating be pretty uncomfortable, pretty embarrassing, but it can also give you a dry mouth, give you headaches, things of that nature. Keep yourself hydrated in order to reduce the risk of these effects. Drinking around 2 liters or so a day could suffice, but you might want to do more than that. This one I really don't like, and I don't like any of them, but this one, palpitations and irregular heartbeats, okay? If you feel like you are experiencing any kind of heart palpitations when taking Clen, you need to go to your doctor immediately and check if you have any kind of heart irregularity, all right? because of your drastically increased heart rate, this side effect is really prominent in people that use clenbuterol, and it can lead to severe health complications, and it could be fatal in some cases as well. All right, throwing your heart, rate off like this and jarring it and confusing it, it's just, I don't know. I don't see the risk versus reward here in any sort of way, shape, or form. Now, coming off clenbuterol, like side effects post-cycle are also present. Weight gain, increased bone fragility, cardiac hypertrophy. These are all possible long-term effects that you could experience after finishing a cycle of clenbuterol, with the latter being particularly frightening. All right, this drug can increase the size of your heart and cause it to beat irregularly, and that could be permanent, okay? It really could. Don't let somebody tell you it couldn't, because it can. Either one can potentially lead to a stroke or an aortic rupture in the future. Neither of which I can assure you want to have happen. Now, let's talk about clenbuterol side effects, on 40 micrograms. Clen is most commonly sold in pill form in doses of 20 micrograms, but there are a few brands out there that sell it at 40 micrograms a pill. Now, this is mainly used in veterinary practices to treat larger animals for conditions like asthma. Some bodybuilders are going to push their limits and experiment with higher dosing. All right. The side effects of taking the more potent pill also include all that I have mentioned about, before with 20 micrograms, but obviously at even a more extreme level. Now, what about women? Women should avoid taking any dose higher than 20 micrograms, because the fact is that women are generally lighter than men, and that leaves them more susceptible to side effects. Now, they're going to probably experience many of the same cardiovascular effects as men when taking clenbuterol, but they can also experience some severe psychiatric effects, anxiety, irritable moods, addiction, things like that. All right, so clenbuterol and hair loss is something that doesn't get talked about as well. It's important to remember that Clen is not an anabolic steroid. It's simply a powerful stimulant designed to trigger weight loss. Therefore, hair loss, one of the most common and embarrassing side effects of steroids, will not occur with clenbuterol. All right, it never gets brought up, but people do think that it's a steroid, and it's not. So this is something that you actually don't have to worry about here. But remember, clenbuterol is not a steroid; it's a stimulant. All right, so don't get those confused, because I see a lot of people that confuse those, and I want to make sure that you understand that it's not an actual steroid. So that is clenbuterol side effects. I hope that helps everybody. I hope that you see that clenbuterol is no joke, something that you want to take very seriously, and something that you should really, really avoid. Dylan Gemelli, signing off.